Hello and welcome back to Pure on the Road. I'm Sam Marichini back at HIMSS 2022. I'm with Jon Kimerle. Jon, you have been coming to HIMSS for quite a long time.
Almost 20 years.
Almost 20 years. So what has changed? What's evolved in healthcare?
Well, clearly the past 10 years has been about implementing and optimizing the EHR. And
EHR.
Electronic Health Record.
Thank you.
That's right. And so, but now all that data has tremendous value. And so the next 5 to 8 years, it's really about taking that data, driving insights, value, and improving care from it. So we're seeing a lot more emphasis on data and leveraging data.
And it's all about the data. And you know, when we think data, we think pure storage, right? And our evergreen business model, allowing our customers to continue to get the latest and greatest without taking downtime, without having to do data migrations. But that's all storage conversation. I think here what I'm seeing more and more are all clinical conversations, or conversations that are business outcomes specific to healthcare.
Clearly, the storage that is bought is a part of a solution or an outcome.
Absolutely.
And that's really the purpose. So the better we can clarify with our partners and customers the actual outcome they're trying to achieve, the better the result in the end, and the better chance of actually improving care.
So when we talk about improving care, what are some of the high-level ways that we're doing that?
Oh, well, the simplest ones is, fast matters.
Fast matters. It does.
And if you can take something that normally took a day or two before a patient got the information they need, and they can get it in minutes or seconds, that just improves care. Whenever you're concerned about something, answers and information is better fast.
And I'd also see that's with a doctor pulling up images or pulling up medical records or integrating that back to prescriptions, all of that, right?
Clearly. Then on the clinician side, fast matters because they're highly paid, highly motivated professionals that are trying to take care of people, and seconds do matter. They can see more people, make better decisions, and take better care of people.
So a couple of things I noticed from working downstairs here for a couple of days, right? And only my second or third HIMSS, I'm not exactly sure. Mm-hmm. I didn't see anybody come up and start asking me about hardware, about infrastructure.
Right.
They all come up and ask about healthcare solutions and how we can help them with some of their issues.
Absolutely. And even our partners, I've had partners come up and, so they sell great products, great solutions, have a great portfolio, but we're getting a lot of feedback from healthcare IT executives that they want integrated solutions really within the ecosystem. So, partners that can add value and build out even broader solutions that outcomes are increasingly important.
And by the way, when we say consolidate, that's less platforms.
Oh, yeah.
Less things to manage, less things to have to take care of, right? So a single software layer that can manage everything for you. Connecting different devices. And also protection, right? I think there's this slight concern with ransomware out there.
Yeah, clearly data protection is continues to be a board level issue, and with a lot of the customers that I'm involved with, 80% are not necessarily at best practice when it comes to not only the backup, but much more the ability to restore in an event like that. Those restore times are now really where they're starting to focus as well.
And that's pulling in our alliance partners as well.
Absolutely.
And it's interesting because it works for data protection. That's an obvious example of leveraging our infrastructure along with an alliance partner and then a channel partner, but expand that into medical records. There's a whole big alliance partner from the healthcare that we're working with to bring those outcomes.
With the electronic health record?
Yes.
Vendors? Yes. So here, because it's fast, reliable, with the evergreen business model, in all industries, that is relevant, but within healthcare, it's even more relevant. And so the majority, a significant number of the electronic health record vendors are running on Pure. And there's a trip even beyond the EHR. There's a lot of other areas where Pure can add value with platforms like enterprise imaging, enterprise resource planning, and now with the pandemic, the virtual care and home care have increased quite a bit. And all those solutions that are taking care of people, do it with data, and that data needs to sit on infrastructure that is supportive. So
that's exactly what we're doing. For more information, visit puresource.com/healthcare. That's where you get connected to all of our healthcare information and experts like Jon here that are helping us have those conversations with you, our customers and partners. Thank you so much.
Thanks, Sam. Thanks.